Thank you very much. Thank you all for being here. I want to begin with you, Mr. Missel. First of all, I want to preface everything I say by saying I think the enormous, vast majority of the people at the Veterans Administration do extraordinary work. These are incredible people who work hard, and many of them are veterans themselves. I think that's always important to say and to thank them for what they do, but we all understand that there are shortcomings in the system. And I know that you recently conducted an evaluation of the quality of care provided at the Orlando VA, obviously in Florida, and you reviewed several aspects of key clinical and administrative processes that affect patient care outcomes, including policies and procedures that address safe medication management and contraband detection. And potentially what I'm about to ask is outside the scope, because I think you focused on anticoagulation medication specifically, but I want to ask your judgment on opioid medication, because it's been reported that VA employees illegally diverted or stole controlled substances, including opioids. This, of course, is unacceptable. And the fact that a nurse was allowed to resign and another employee was merely suspended for 2 weeks, I believe, is outrageous and intolerable. And and I lay that as a predicate for the follow-up question I have, but what can we first do? What recommendations do you have, whether it's opiates or anticoagulation, that we could impose to better mitigate the protocol and the abuse of these medications? I know we're focused on suicide prevention, but we've seen the link between substance abuse and suicide in veterans. And so it would be tragic if the source of whether it's an opiate addiction or the like is the VA system. So what can we do? What can be done to better mitigate the protocol or change the protocol and the abuse of medications?
Well, we're looking at this from a number of different perspectives. In the past, as part of our inspection program, we inspect the medical facilities at least every 3 years or so. In the past, we've had a protocol to look at it and to make any recommendations where their procedures may not have been as effective as they could be, or that they weren't implementing those procedures. We also have a very aggressive criminal investigation into a number of drug diversions of controlled substances and other ones. Unfortunately, we have a number of open investigations now. In the past, we've worked with the Department of Justice to prosecute a number of people, whether they were VA employees or those who had access to controlled substances within VA medical centers. And one of our goals is to try to act as a deterrent there, to make sure that it's clear that if VA staff or others divert, steal controlled substances, that we're going to be very aggressive in terms of the prosecution.
Is there any indication that the diversion problem at the VA is substantially broader than what you may find at any other facility?
I've seen some studies on that, and it's a problem across a number of facilities. I don't think it's substantially greater at VA than some of the others, but I'm not sure if all the studies are that broad.
And so my follow-up question is for you, Dr. Clancy. And again, I want to reiterate, as I said, the incredible work that the people who work under you are doing at the administration. But I remain concerned, and it's why I've sponsored legislation to address it, that under existing civil service laws and rules, we're either unwilling or unable to sometimes hold the remaining few who are doing a poor job, whether it's a bad job or even worse in some instances, some of the things we've just outlined here today, that under the existing civil service laws, we are either unable or unwilling to hold accountable people for their actions. And so is it your view, generally, that the department currently has the authority it needs to manage the workforce and its employees accordingly, and in particular hold people accountable?
We do have authority. I think where we have fallen down in the past is that it can be a lengthy process. And I will say in the area of opioid narcotic diversion, Secretary Shulkin has made it very clear our tolerance level is 0 and that we will react promptly when employees divert that medication. We believe that it is, if anything, less than the private sector, but it's not easy to find consistently good data in the private sector. Secretary Shulkin has made accountability one of his top priorities, so I think that you're going to see that it's a new day at VA, and I will leave it at that, but would be happy to follow up with specific questions for the record.
Absolutely. In my closing, just to say that, we have worked and continue to work on accountability legislation that the Secretary supports to give them the authority to remove people.
Absolutely.
Not in an unfair way. We're not interested in witch hunts. We're not interested. We need good people. I don't think there's any interest in removing good
No.
people for political purposes or otherwise. But we remain concerned, and I think the Secretary shares this view in his public statements, that the VA at this time does not have the authority it needs to remove people in an expeditious manner if they choose or find the need to do so. And so I look forward to hopefully working with you and others to get that done, Mr. Chairman. Thank you.
Well, if I might just note, Senator, just that this week we've had senior leaders across our system all together out at a meeting, and so the Secretary was very, very, very clear about this, and actually was doing problem solving with individuals to say, how can we help you? Because oftentimes our leaders want to act more expeditiously, and it's tricky. And he walked us through what the legislation is and that he welcomes it.